Yes, ma'am, we are live now.
Yes.
So, good evening, esteemed faculty members and all the delegates. Thank you for joining. This is Sahiti on behalf of Shield Connect, welcoming you all for today's series, Pinnacle News Series, Episode 3, and the topic is Adolescent Pregnancy in association with Hapur, Purnia, Pandarpur, Sahasra, Akluj, and Belgaum OBGYN societies. It's my privilege to introduce the moderator of this webinar, Dr. Madhumita Ma'am. Ma'am is the consultant obstetrician and gynecologist from Salem and treasurer of Salem.
Thank you, Sahati. I'll take over from here. Thank you very much.
I welcome you, ma'am.
Thank you so much. Thank you. So can we go? Can we have Sampath ma'am's slide?
Just to tell Madhumita, no problem.
Yes, ma'am. So this Pinnacle News series, which connects all the four corners of India, is brought to us by Professor Dr. Sampath Kumari ma'am, who's a past Vice President of FOXY and Senate member of Tamil Nadu Dr. MGR Medical University. She's a national corresponding editor of JOGI, founder secretary of Tamil Nadu Federation of Obstetric and Gynecology, and she's also the President Board of Studies of Obstetric and Gynecology in Tamil Nadu Dr. MGR Medical University, chair and past chairperson of FOXY Adolescent Health Committee, and she received the first ICOG Distinguished General Council Member Award and chairperson of Women's Wing IMA Chennai South, and also she received the IMA National President's Award and an IMA Tamil Nadu State Branch Award in 2021. So we're very happy that you got this webinar series for with clinical and practical points for all of us, ma'am. So we move on to the prayer song. Sampath ma'am will introduce the chief guest.
Yes, first we'll go with the welcome address. I welcome you all for this Pinnacle series. This is our Pinnacle series number 3. I'm conducting this on every second and fourth Thursday of every month. Now we are selecting the societies from north, east, west, and south. So it is called as Pinnacle News. Now I welcome the Hapur Society President, Dr. Uma Sharma, Secretary, Dr. Namita, and Purnia Society, Dr. Bibaja, President, and Anuradha, Madam, Secretary, and the Sahasa Society, Dr. Kalyani Singh, President, and Dr. Sangeeta, Secretary, and Bandarpur, President, Dr. Sudesh Joshi, and Secretary, Dr. Sachin Pawar, Akul Society, Dr. Bharat Pawar, President, and Dr. Manisha, Secretary, Belgaum Society, Dr. Sumaya Firdaus, President, and Dr. Sweta Patel, Secretary. And I welcome our Dr. Chief Guest, Dr. Ranjana Khanna. Immediately when I contacted her, immediately she accepted. And I welcome the guest of honor, Dr. Bella, Dr. Firdaus, and Dr. Bharat Pawar. And we have the two scientific sessions, one being the lecture by Dr. Sachin Pawar on teenage pregnancy. And we have the panel for this chairing being Dr. Kalyani Singh. And we have the panel on POXO Act and MTP Act. That also I got the help from Dr. Madan. He only suggested Dr. Sudesh. He is accepted to moderate the panel. And Dr. Uma Sharma will be the expert. And we have the panelists, Dr. Sangeeta, Dr. Madan, Dr. Biba Jha, and Dr. Anuradha, Dr. Hema Patel, and Dr. Swati. So I welcome you all. Now I have a great pleasure in introducing Dr. Ranjana Khanna. Ranjana Khanna madam was, she is supposed to tell the queen of now the Kumbh Mela. Her place, and she was the national vice president on 2017 and founder president of ISOP Prayagraj and ICOG governing council member till 25 and the president Allahabad 2021 to 25, organizing chairperson for many national Foxy conferences, and she has many awards to her credit. Foxy Achiever Award, DIRA Award, and DK Tank Reproductive Healthcare Promotion Trophy, and Save the Girl Child Award in ACOG 2013. He has been in various national and international conferences. We have been moving with her with the FIGO conference last year in Europe, I think, and delivered the prestigious Dr. Prabha Malhotra oration. And she has many articles and chapters in various books and journals. Dr. Ranjana madam, welcome. And I wish bless our TME.
A
Yes.
very good evening to all the faculty and delegates who are present. And I congratulate you, Dr. Sampath, for arranging these Pinnacle News series. The topic itself is very catchy. So it is, and I'm sure with your dedication to adolescent health, you are going to take it a long way. And I think you worked a lot for adolescent health. You are the first one who raised it to another level altogether. Teenage pregnancy, we all know, is a very burning problem. And it has been highlighted so much now by the social media. It's not that we didn't have cases. I'm talking around 40 years back when I was doing my post graduation. Then we had a lot of these cases, and these girls would come in the seventh, eighth month, when it was accidentally the baby bump was discovered by the mother, and then she would come bashing her up all the time, and they would bring her to us. So but now one thing is good, that with the advent of contraceptive awareness, and lot of these adolescent girls are very well aware now of the sexual activities, and they are very well aware of how to protect themselves. And of course they are also know about the morning after pill, so they are very well aware now. But still this is a burning problem and has to be tackled. So it's a pleasure that we have on board Dr. Uma Sharma and Dr. Namita from Hapur Society. I remember I got an extremely warm welcome, and their hospitality was really unmatched, and the audience so attentive when I gave my scientific address. And it is a pleasure to have presidents and secretaries of Purnia Society, Saharsa, Pandharpur, Belgaum, and Akluj OBGYN societies. The thought behind this webinar series is a novel one. I wish this webinar success, and I wish Dr. Sampath Kumar all the best in her future endeavors.
Thank you so much, madam. In spite your place is busy with the Kumbh Mela, you have joined. Anyway, we will come and stay in your place. Okay, thank you,
Most
madam.
welcome.
Thank you. If time permits, you be there for the talk at the panel. Next, I wish to introduce the guest of honor, Dr. Sumaya Firdosa. She has joined, I think. Madam is there, no? Sumaya, madam?
Yeah, she's there.
Yes. Madam is a consultant OBGYN for more than 28 years, and she is the medical director of the city of Belagavi and the president of Belgaum Society and joint secretary of IMS Society of Belgaum chapter. Madam Sumaya, madam, welcome, and we wish to please bless our webinar.
Thank you very much, madam. I would like to congratulate you, Sampath Kumari, madam, for this wonderful webinar. The topic, like Dr. Ranjana Khanna, madam, has told, the topic is very interesting and very important from private practitioners' point of view also. not only from the teaching faculty. I really appreciate, because this is a topic which has not been discussed very often in the webinars and conferences. It needs a lot of attention. Even though we have raised the age of marriage, still the girls continue to get married at 17 years, 16 years, and we have patients who are running helter-skelter, for the ANC, because they are scared of the long arm of the law. The parents don't know where to take them for the antenatal care. Our members, the blocks members, the FOXY members don't know what to do with these patients. Reporting them again means harassment to the patients. So we need some clarity. We need a lot of discussion on the POSCO Act and also on adolescent health as well as adolescent pregnancy. Hearty congratulations, madam, and wish you all the best. I'm sure this is going to be a very interactive and very interesting webinar.
Yes, madam. In Tamil Nadu, what happens, for all pregnancy, there is a Muthulakshmi Reddy scheme. They will give around 18,000 for before antenatal, during delivery and postnatal. But for teenage pregnancy, that money is not given. We are talking about teenage pregnancy, but still it is not reduced. Anyway, we will see our speakers.
But 18 is the legal age of marriage. So even if she becomes pregnant at 19, they won't give.
No. Till during this period, 19, they can get it.
Yeah. I mean, that is also teenage.
Yes,
teenage. It's 19 is also teen only.
Yes, nowadays it has extended up to 21. This adolescent.
Not only that, ma'am, the ground reality is in villages, the girls get married at 16, 17.
Yeah.
You can't get even antenatal care from a private practitioner, even in government hospitals.
Yes,
because the doctor is supposed to report to the police, and then the parents face harassment.
No, but they tell lies, at least when they come in the private sector. They never claim that they are 16, 17. They will say they are 18, though they...
Madam, now we have the Aadhaar card.
Aadhaar card.
In our state, we require Aadhaar card for registration.
Everywhere.
So it's a real problem. That's the ground reality, and we just don't know. This POSCO Act at times seems like putting the cart before the horse.
So that is the reason I kept pregnancy and POSCO Act.
Brought this law.
Yes. Now I welcome Dr. Bharat Pawar. Sahiti, Bharat Pawar CV. Yes, he is a consultant obstetrician and gynecologist, sonologist and infertility specialist, Anand Hospital. I think I'm not pronouncing it correctly. Malshiras.
Yes, ma'am.
Vatsalya Fertility Center, and practicing since last 22 years, that too in the rural area. His special interest is preventive obstetric sonography and infertility. Bharat sir, please bless our webinar.
Good evening, ma'am, and all. It's an honor to be on this platform for Pinnacle News Series 3rd episode on adolescent pregnancy. Small societies like ours and across the pan-India are being included in this series, and we are happy to be here under the dynamic leadership of Dr. Sampath Kumari Madam to assure today's burning topics in adolescent health. It will be a fruitful discussion and nice take-home messages for all of us. I congratulate Dr. Sampath Kumari Madam and assure strong support for all her upcoming ventures in FOXY. Thank you, ma'am.
Thank you so much, sir. Thank you so much. Bellat sir, have you joined? I think he didn't join. He is from Belgaum. Whenever he comes, we will get the blessings. Now, thank you for Ranjana Madam, Bharat Pawar and Sumaya Madam for the wishes, and we will go with the scientific session. Thank you, sir. Dr. Madhumita?
Yes, ma'am.
Can I
have this? Yes, ma'am.
Yes.
Sati, can I have the next slide? So moving on to the scientific session. Our first session is talk by Dr. Kalyani Singh, who's the president of Sahasra Obstetric and Gynecological Society, chaired by Dr. Sachin Pawar, who's the secretary of Pandarpur Society. Dr. Sachin Pawar, he's a gynecologist at Sanjeevani Nursing Home at Pandarpur, and he's the present secretary of the Pandarpur Obstetric and Gynecological Society, and he's received the best paper presentation amongst, and he's also has a case study published in FOXY journal on the role of mannitol in preeclampsia and eclampsia. Sir is...
Yeah, ma'am.
Yes, sir. Yes. Can you please introduce the speaker, sir, and then we proceed?
Yeah. Good evening, all. It is my privilege to be chairing this session. I would like to introduce Dr. Kalyani Singh, ma'am. She is Professor of Obstetrics and Gynecology at Lord Buddha Koshi Medical College and Hospital, Saharsa. She is founder member and chairman of the Lord Buddha Koshu Medical College and Hospital. She's consultant at PK Hospital, Saharsa, and she's also consultant at Kalyani IVF. She's founder, member, and president of Obstetric Gynec Society of Saharsa. She has published many papers in national and international journals. And she's also a member of editorial board of Journal of Obstetrics and Gynecology Advancements, UK. So I would like ma'am to, I request ma'am to conduct the further session. Thank you, ma'am.
Thank you. Kalyani ma'am?
Ma'am is here.
Yes, I saw her.
Yes, ma'am is here. She's just unmuted. She's here.
Madam, you can share your presentation. Kalyani madam?
Yes, but how will I show the video on this platform? Because
We
We
put
can
in the
see
group.
your video, ma'am.
We can see your video.
You can see. Okay.
Yes,
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 we
ma'am.
can see.
Your video we can
Okay.
see.
Okay. So, first of all, a very good evening to all. And
Madam, do you want to share the PPT?
yes, I want to share the PPT.
Yes,
Then you
ma'am.
can do it.
So how?
Or else you put the PPT in the group, Sakiti will do it.
Okay.
Uh,
Where is-
You open your PPT, madam, first.
But I will open. I will share you not in the group, but in your personal WhatsApp number.
No, you are in the group only, madam. Kalyani
Yes,
madam, you
I
are
am
in
in the group, but I have two WhatsApp numbers, so there are some problems with the
Yeah.
two.
Ma'am, if you're comfortable sharing by yourself, that is also fine, ma'am.
Okay,
If there
okay.
is any issue, then I will share it, ma'am.
Okay. Thank you.
Have you opened the PPT in your screen, ma'am?
Yes, I have opened. Can you see it?
No, ma'am.
No, ma'am. Now go back to the Zoom and then down there is a green arrow, no, ma'am. Share screen.
Just wait 2-3 minutes. Yeah, 1 minute.
Sachin sir, what is the prevalence of teenage pregnancy in your place?
Prevalence of teenage pregnancy. Okay.
In our government
So-
hospital and all, it comes around nowadays 14%
Okay.
every month.
I mean, yeah, ma'am. There is still a large population group which are coming with teenage pregnancies because we and Dr. Sudesh sir, we are practicing in Pandharpur.
That is the reason I was asking what is about in the rural places. The main
In the-
itself, we are having 14%.
Here we are having, madam, 30 to 40%. The patient
Oh,
directly
primary
claimed
level.
that she is 19 years old.
Oh, Bharat sir, you are from Akulj, no? In your
Yeah,
place,
it's also a ruler.
40%.
It's also a ruler place.
Oh, 40% means we have to, sir, you have to increase the school counseling, sir. That is the only way. Education
Yes.
alone can reduce it.
Like we
May
also
I
come-
intervene, Dr.
Can you-
Sampath Kumari?
Yes, sir, Sudesh sir.
Yes.
Can you share? Can you see the?
We actu-
Kalyani, ma'am.
No, ma'am.
No, just I'm trying to share it. Okay.
Actually, what happens is it is not only the school counseling, it is the social background of the
Yes,
girl
sir.
which matters.
Hmm.
The parents who are little uneducated, who come from few areas and few communities in our place are there. Not to blame any religion, but the social and cultural setup is such that they want to get the girl married once she menstruates. They
Yes,
say it is the
after
nature has
menarche.
given the signal, and why should we wait? And though we have education
first
literacy in Maharashtra is going on, but still few rural pockets are there and few communities there who still haven't understood the importance of getting married at the right age. Though the law is there, POXO is there, but the ground reality is that, as Dr. Bharat said and Dr. Sachin said,
Can
we
you
are
see?
having 30 to
Can you see,
40%
ma'am?
teenage primary gravidas coming as
Mhm.
registered
Kalyani
to
madam,
register
we
in
are
our
not
clinics.
able to see.
Can you see? Are you able to see? No.
No,
No,
madam.
You
Okay.
can share your PPT in group, ma'am, so that I will share on behalf of you.
Okay.
Or else you send to me, madam.
सॉल्टी इसको देखो तो इतना जैसा ये देखो यहाँ पर है
Or
ना
else if everyone is there means we can go with the panel, madam.
और एक वन देखो ये शेयर है ना यहाँ पर दिए डाले शेयर शेयर स्क्रीन ऑप्शन ये हो सकता है, कैसे कर सकते हैं इसको, देखो।
Sakiti, you guide him.
Yeah, yeah. Ma'am, you need to click on the green color share option, which is in Zoom, and then select the PPT tab and then share.
Ma'am, I've just messaged you. Can you otherwise share
One
it?
minute,
My
now she has
Now we
started.
can see your
Yeah,
screen,
it's
ma'am.
done.
Just open the PPT, ma'am.
Okay. ओपन करोगे इसको? हाँ,
yes, ma'am. Just open that, ma'am. Ma'am, you don't need to move that. You just need
ओपन
to.
ओपन करो इसको,
Just double click it, ma'am.
Okay. Can you see now?
Yes. Can you
Yes.
maximize it, ma'am?
Yeah, this one,
Yes,
maximum, opposite to that, into.
No, not that. Right.
Yes.
Can you see?
Yes.
On the
this
right
one.
side, ma'am.
Yes, you can. Yes.
On the right side, right of the screen.
Yeah, it was maximized.
Yes.
क्या हो
No,
रहा है? इसको करो, इधर लाओ, इधर इसको लाके मैक्सिमाइज करो ना।
एक्चुअली वो देख रहे हैं ना,
ओके, ठीक है।
मेरा पिक्चर आ रहा है।
क्या?
मेरा पिक्चर क्या
अच्छा,
है?
छोड़ो ना, देखो मैं कर दूं जरा से इसको।
yes, we can proceed, madam, if you are not able to
Yes.
comfortably
Okay, okay.
proceed. No problem.
Maximize it.
Yes, ma'am. Just maximize it like before, ma'am.
Yeah.
Ma'am, it's closed.
Closed, ma'am, now.
Just open it again and maximize it, ma'am. Yes, ma'am. Just maximize it.
No.
Maximize, it's going, I think.
No, ma'am.
No,
Ma'am,
not
this
that
tab
one.
will just maximize
It's
it,
a
ma'am.
square box. You need to click on the square box, not the minus box.
The next.
Yes.
Yeah, that one, that
Yes,
one.
please click on that.
Click on that.
हाँ, वो वाला, हाँ। Yes.
Yes,
Now we can see.
fine, ma'am. This,
Madam, you
Okay.
proceed.
Okay. A pregnancy in teenage women that is 13 to 19 years of age is termed as teenage pregnancy. A girl may get pregnant if she has vaginal sex after she has started menstruation or she wants to start menstruation. So she can have pregnancy even the menstruation hasn't started. According to the Centers for Disease Control and Prevention, in 2017, around 194,000 babies were born to American girls between the age of 15 and 19.
No, just one.
इसको अच्छा, हाँ।
हाँ।
A synonymous term is adolescent pregnancy. According to WHO, any pregnancy in between 10 to 19 years of age is adolescent pregnancy. For practical purposes, both may be considered same. It is divided under three categories. First is early adolescent, that is 14 years and less. In this period, rapid physical changes, self-centeredness occurs. They are fantasy thinker, does not see the consequences of their behavior. Middle adolescent is 15 to 17 years of age, challenges authority, some sort of rebellion, fluctuates between wanting to be adult but fearing responsibilities. Late adolescent, that is 18 to 19 years, think abstractly and anticipates consequences, more confident of the personal identity. Teenage pregnancy is a complex issue that can have both positive and negative outcomes for the mother and child involved. It is important to recognize that every situation is different and outcomes can vary widely. However, studies has shown that a significant percentage of teenage pregnancy do result in positive outcomes for both mother and the child. A strong family support system as well as access to healthcare system and educational system are needed for positive outcomes. However, 85% of teenage pregnancy are unplanned with more negative results. Socioeconomic and cultural factors like poverty, race, or educational achievements influence the childbirth age. Poor and illiterate people prefer child marriage. Media influences like mobile phones, TV, internet, movies, etc., give improper and incomplete information. This occurs mostly in the rich and the educated class. Psychological factors where teens may have underlying desire to retaliate against their parents is also a cause of the teenage pregnancy. Incidence. In 2023, globally, 41 female per 1,000 gave birth between the age of 15 to 19. From 2015 to 2021, an estimated 40% of adolescent girls and young women globally reported giving birth before age of 18. Teenage birth rate is higher in lower and middle income countries compared to the higher income countries. 3.9 million had abortions. It is more common in rural than urban areas. In 2021, 13.3 million babies, or about 10% of the total birth worldwide, were born to teenage mothers. So this is a huge number. Negative effects of the pregnancy. Effects could be on the mother, father, baby, family, and the society. Effects on mothers of physical health are more chances of preeclampsia, anemia, sexually transmitted diseases. Premature delivery are very common and low birth weight. Damage to the reproductive system, which may lead to pelvic organ prolapse and incontinence at earlier age. It may affect mental health. Girl may have postpartum depression, long-term depression, suicidal ideation, and post-traumatic stress disorder. It may affect her education. Teenage mothers are more likely to drop out from high school, which may limit her educational growth and economical opportunities. Only 50% of teen mothers graduate compared to 90% of non-pregnant girls. Negative effects on children. There is increased risk of low birth weight, increased risk of prematurity. Premature birth may have lifelong impact on baby's development, mental and the physical health. In fact, infant mortality is increased. Behavioral problems due to the lack of proper care and the love from the parents and the family. Lower school achievements, social and financial insecurities of the parents may provide less education. In our time, many boys and girls used to get married and had babies before their admission in medical college. Consequently, they couldn't plan well for their children's education. There is a greater risk of unemployment or underemployment, again, maybe due to the poor education and the proper guidance. Baby may need foster care replacement. More likely, one has to rely more on the public health care. Daughters of teenage mothers are at greater risk of being married early and having teenage pregnancy, leading to intergenerational cycle of the poverty. Causes of teenage pregnancy. There is a lack of information about sexual and reproductive health and rights. Family, community, and social pressure to marry. Sexual abuse and violence. Early teenage post-marriage. Lack of education or school dropouts, limited access to contraceptives, poverty, more number of girls in families also a cause of the early marriages, cultural variation, drug or alcohol abuse. Solutions, educational intervention. They need teaching. Good and free conversation between children and the parents. Sex and family life education. Girls must be educated about good touch and the bad touch. Abstain from the sexual intercourse. Individual counseling. Community programs. Family and the social support. Access to birth control devices. There are a few benefits of teenage pregnancy also. There is high fertility rate, that is more physiological, lesser pregnancy-related complications and more normal deliveries like diabetes and the pregnancy-related complications like diabetes and hypertension and more normal deliveries occur. Comparatively easy delivery, mostly due to the small babies. As grandmothers are still young, so better care of mother and babies by girls' parents and in-laws. Early settlement of children, and they may have a big family also. Conclusion. Early and mid-teenage are developmental periods So pregnancy should be absolutely contraindicated. There should not be any pregnancy before the age of the 18th, which is the legal age of marriage. Sex education should be given. Late teenage pregnancy is permissible by the society and law, so the girls must be counseled regarding pregnancy and the contraception before they are married or after they are married. If pregnancy takes place, a strong family support, medical and social help must be provided to the mother. That is very essential part of the teenage pregnancy. Lastly, POXO Act should be strictly executed to save the teenage girls. Thank you.
Thank you, Kalyani
Uh,
ma'am.
Thank you. Sachin sir, your
Yeah, ma'am. Yeah.
opening remarks.
It was a very elaborate and very nicely explained uh, about the awareness and how, being practitioners, we can take a steps to reduce the teenage pregnancies, as well as the counseling part, and basically the POXO Act, which is implemented nowadays, and how the society should get to know about the POXO Act and its consequences. So it was very informative and educational lecture, ma'am. Thank you so much.
Thank you.
Thank you, Dr. Sachin and Dr. Kalyani ma'am. Madhumita, you can introduce the moderator and the panelists.
Yes, ma'am. Sahiti, can I have the slides for the panel? So moving on to our second session, we have a very interesting and informative panel discussion on POXO Act and MTP Act. To moderate this panel, we have our Dr. Sudesh Joshi, who's a senior obstetrician and medical legal consultant, and he's working since 28 years at Agraj Hospital at Pandharpur, Maharashtra. He was also the chairperson of Adolescent Health Committee and Medical Legal Committee of AMOX, and he's a member of NIMC PCPNDT of FOXY, president of Pandharpur OB-GYN Society, and vice president of IMLEA Maharashtra chapter, and he's a state coordinator of AMOX. And we have, next slide please, we have our expert, Dr. Uma Sharma, who's the president of Hapur OB-GYN Society. Welcome, ma'am. And we have our expert panelists, Dr. Sangeeta Thakur, who's a senior consultant at Sahasra, and she's a practicing consultant gynecologist at Isa Nursing Home, and she's also the secretary of Sahasra Obstetric and Gynecological Society. Next, we have the very eminent Dr. Madan Kamble, who's a consultant obstetrician and aesthetic gynecologist, and he's also the chairperson of AMOX Aesthetic and Sexual Medicine Committee, and he's the past secretary and president of Agraj Obstetric and Gynecological Society, member of FOXY Sexual Medicine Committee, and he's also the national coordinator of FOXY Sexual Medicine Committee, and organizing chairperson of AMOX Zonal Conference of Sexual Medicine. Next slide, we have Dr. Biba Jha, who's the director of Saloni Nursing Home and founder president of Obstetric and Gynecological Society of Purnia, and she's received the Lifetime Achievement Award from IMA. And next slide, please. We have Dr. Anuradha Sinha, who's the secretary of Purnia Obstetric and Gynecological Society and district coordinator of Lakshya UNICEF FOXY program, and she has special interest in social and medical relief work. Next slide, please. And we have Dr. Hema Patil, who's an associate professor at Belgavi in Karnataka, and she has numerous national and international publications, and her area of interest is high-risk pregnancy, preventive oncology, and colposcopy. We have Dr. Swati, who's assistant professor at Chennai, and she has numerous publications and papers to her credit. Welcome, ma'am. So we'll move on to our panel.
Madhumita, 1 minute. Dr. Bellat sir has joined us. He's one of the guests of honor. He didn't join, I think. Anyway,
Yes,
Sudesh sir, you can start your present.
Please allow me to share my screen.
Sahiti, make him a co-host.
Okay, ma'am.
Yes, made. Sudesh sir, now you are co-host. You can share it.
Okay, thank you. Desktop. Is my screen visible? Hello?
Yes, sir, we're able
Yes,
to
sir.
see.
Your screen is visible, sir, but PPT has not yet opened.
Okay, I'm just opening the PPT. Is it okay?
No, sir.
Is the PPT?
No,
No?
sir.
Okay, then I got you. Okay.
Minimize this tab, sir, so that we might.
Okay, screen share.
Sir, I have stop share. Kindly reshare it, sir. At first, please open the PPT and then start sharing, sir.
Okay, I will first open the PPT,
Yes, sir.
then
Yes.
start sharing. Okay.
Yes, sir.
Thank you. Is it visible? Hello?
So, no, sir.
Okay. Minimized. Close this. I'll open the PowerPoint presentation. Okay. Now I will share it. Something is coming out screen. Yeah.
Please come to Zoom, sir. Yeah. Yes,
Yeah.
we can see, sir.
Yes.
Perfect, sir.
Okay. Thank you. Thank you. Now I have shared the presentation with all the panelists so that we have a fair idea what we are going to talk about. So POCSO and MTP Act are the two acts which we are all going through for so many years. We had the amendments. We first went for the amendment, then there were again things, and finally the new MTP Act has been into practice. So now I will be asking the questions in the format where we have case scenarios rather than going for a theory question like please write these documents, something like that. We'll go for case scenarios. Any panelist who has the knowledge about that case can spontaneously answer the question, or I will ask them. Now, blessings from Pandharpur. We know Kumbh Mela is going at Prayagraj, but Pandharpur also is a holy place with Bhima River. And we have something called as Ashadi Wari in Ashad, where we have 10 lakh pilgrims coming, walking all the way 200 kilometers from Pune to Pandharpur and having a holy dip in Bhima River. This is my newly built hospital. And now we directly come to the panel discussion. Now, this is case scenario one. Mrs. ABC, age 26 years, G2P1 with 7 weeks amenorrhea, comes to my hospital for termination. Now, I will pose this question to Dr. Madan Kamble. What are the lab institutions would you advise for this patient? And is UAG necessary, mandatory, or desirable for this patient? Dr. Madan, please.
Yes, thank you. We should offer the basic lab investigations for this patient like CBC, urine, blood group, and HIV and Australia antigen at least. And as far as the ultrasound is concerned, though it is not mandatory, but we should do ultrasound for the safety of patient and doctor. Yeah.
Yeah. What specific would you like to see in the ultrasound for this patient?
Yeah. Whether the pregnancy is intrauterine or extrauterine, we have to rule out the ectopic pregnancy. That's all.
Yeah, something else, because we have now different modalities of doing a termination by either tablets or pills or vagina, medical surgical curettage and so. So would the duration of amenorrhea, would you like to say that it coincides with the duration of pregnancy on the ultrasound?
Yes, sir.
Hello?
Definitely ultrasound is indicated, sir. Though the laws say that the WHO guidelines and all say that you can give it only on UPT, but in practicality, it's very difficult. And most of these women, they don't tell the history, sir. They say it is 7 weeks, but when we palpate, no, uterus will be 12 weeks. So that kind of a finding may be there. So it's better to have some evidence that how many weeks it was, what was done, and it will save both the patient as well as the doctor.
Yeah, quite right, Dr. Hema. Thank you for that answer. So to summarize, the basic investigations would be apart from clinical examination, lab investigations like CBC I would specifically emphasize on CBC and not only hemoglobin, because many times now when we have dengue fever and all going on, sometimes the platelets may be very low and it could be dangerous to do a termination in those cases. So CBC, complete blood count, hemoglobin and RBCs and platelets. Blood group, because if she's Rh negative, then we will again have problems for Rh sensitization, urine routine to rule out infection. And as Dr. Hima quietly pointed out, UAG not mandatory, but desirable for three things. One, to rule out ectopic pregnancy. And secondly, to ascertain the gestational age, so that we don't choose the wrong method for termination of pregnancy. Thank you so much. Now we move on to second question. Who will terminate the pregnancy? For example, the case scenario is not this patient ultrasound has confirmed that it is a live intrauterine 8 weeks pregnancy. Now I'm a senior consultant. I'm out of station delivering a talk with somewhere, or I'm busy in the Zoom. So my son, who has done MBBS and worked at OBJ hospital for 3 months, is in charge of the patient. Can he terminate the pregnancy? Yes, any of the panelists can take. The hospital is registered. The center is registered. He is a person MBBS and he has only experience of in OBJ hospital of 3 months. Is he eligible to do termination of the pregnancy of 8 weeks?
Yes, sir.
Yes, ma'am, please.
Yes, he is eligible to do up to 9 weeks. He is eligible if he has completed 3 months work in OBG, and at least he has practiced 3 months in and performed 10 cases independently in medical abortion. Then he is eligible to do the MTP.
Yes, by what method, ma'am?
By medical method. By medical abortion, sir.
Abortion.
Yes, ma'am. Thank you. Thank you for those inputs. So this I wanted to emphasize because this has been what we need for termination of pregnancy has been added and in the new amendment. Now the government all over wants to increase the number of service providers for termination of pregnancy, because we know, because there are very few qualified service providers for undergoing termination and people go to quacks. So if we have enough number of qualified people giving services to the patient for medical termination of pregnancy, they will not go to quacks. So they want to broaden the spectrum. So for different the gestation of pregnancy, different duration of pregnancy, they have different qualifications. So basic qualification, any person who is MBBS registered in the state council or the national council and has experience of 3 months practice in OBGYN, now he is eligible to do termination of pregnancy up to 9 weeks with only medical methods of abortion. And then other qualifications have been there, that for less than 12 weeks, if you have to surgical termination, then government medical officers, MBBS, who have undergone training for surgical MTP can do MTP up to 12 weeks. And all other qualifications like qualified gynecologist can do MTP for the further duration. So this I wanted to emphasize. That's why specifically I asked these questions. Anyone wants to contribute anything else other than this? Any panelist, please? Okay, we move on to the next question. This is again, the clause CA has been included up to 9 weeks of gestation period by medical methods of abortion, experience in any hospital for a period not less than 3 months in the practice of OBGYN. That is enough. Now case scenario, next case scenario is that G2P1L1, she is 28 years old. Now she is 22 weeks pregnant. And unfortunately, she lost her husband 2 weeks ago in a mishap. She is not financially independent. She has loans. She desires termination. And the bank officials are asking for papers. Now, Dr. Patil, is she eligible to undergo termination? 22 weeks, lost her husband.
Sir, the new amendments have come under which she comes under that vulnerable group, special group, sir, after 20 weeks. So she can undergo the termination of pregnancy.
Yes, with the new amendment, now they have made a separate group from 20 to 24 weeks, where we know that the patient is likely to cross 20 weeks. Maybe she is not, the termination facility is not accessible to her. She's not able to come to her, to the termination facility. So these are the vulnerable specific groups where women are eligible for termination up to 24 weeks, from 20 to 24 weeks. And the C column, which is the change in marital status during ongoing pregnancy, death or divorce. Now, what is important is change in marital status during ongoing pregnancy. She has to be pregnant when the spouse is not there, or she has to get the divorce when she is pregnant. So she has got divorced 5 years ago, and now she is pregnant again, and she says that I want to divorce for change of marital status. That is not acceptable, because this is a nonsense which we need to discuss so that we remember it. Because many times what happens, change of marital status, that is what we remember. We don't remember during ongoing pregnancy. That's why specifically I took this case. Then survivors of sexual assault, rape or incest, minors, we know minors, when they get pregnant, they do not know they are pregnant. If they come to know they are pregnant, they are not ready to accept they are pregnant. And then they are very afraid of telling their parents or their in-laws or anyone that they are pregnant. And so we know that the timeline which they are going to come to the facility which is going to provide termination is going to be very long. So that's why 20 to 24 weeks has been kept there. Mentally ill women, including mental retardation, and women with physical disabilities. Now, physical disability, they are not given as a plain thing. They have said that major disability as per the Rights of Persons with Disability Act 216. So these have been defined which disability patient can undergo termination beyond 20 weeks to 24 weeks. And fetal malformation is there. Now we know cardiac anomalies are found at around 22 weeks, 23 weeks, then we can terminate them. Now for this, we do not require the permission of the medical board, but the only thing which we need is we require opinion of 2 people. Previously, opinion of 2 people was required from 12 to 20 weeks, but now they have increased it from 20 to 24 weeks. We require 2 practitioners for forming the opinion. Now, failure of contraception. Now, the next panelist can answer this question. Mrs. ABC, G3P3 tubectomy done. Unfortunately, she conceived again unknowingly, and now she discovers that she's pregnant, but she is 22 weeks. Now, can she undergo termination of pregnancy for failed tubectomy at 22 weeks?
No.
No,
Sir. No, sir.
Yeah.
No.
Thank you all the panelists for answering that, because what happens, we feel that failure of contraception is the indication, is the simplest thing. India, the law is very easy. You can just tell failure of contraception and do MTP, but failure of contraception is a indication only till 20 weeks of pregnancy. If we go beyond 20 weeks, then that indication cannot be done, because even though it is a tubectomy failure, but she has to come to know that till 20 weeks that her tubectomy is failed. If she goes beyond 20 weeks, then by current law, we cannot terminate the pregnancy for the indication failure of contraception. Now the patient may have to go to court or may have to go to the board and then decide. But in present law structure, we cannot terminate the pregnancy beyond 20 weeks for failure of contraception. So what I have to say is failure of contraception is not an indication beyond it. Now, this is Form E, where the indications for 20 to 24 weeks have been summarized. Now, can any of the panelists tell me what is the legal procedure or what is the paperwork you do if patient comes to you for MTP? Dr. Swati, you can answer this. If the patient comes to you at around 10 weeks for MTP, what is the paperwork you do? 1, 2, 3, 4, 5.
We should register we should get consent, sir, first of all. The consent of if she is above 18 years, she herself has the right to give consent. And if she is not, she is below 18 years, her guardian can give the consent. She should be in her sound mind as well. And we should fill Form E. It's about the opinion form from the registered medical practitioner regarding the qualification, where it is conducted, what procedure we are going to do. And also the method of the termination.
Yeah, I would like to summarize this. There are specific forms which are given in the MTP Act. Form 1 is where you write the name of the doctor's name and the patient's name and the indication for termination of pregnancy. Form 1 till 20 weeks and Form E from 20 to 24 weeks. Then Form C is the consent of the patient, where it is written that I want to undergo termination for such and such reason and my age and address. That is Form C. So Form C is the consent. Form 1 or Form E is the opinion form. Form 1 is till 20 weeks of pregnancy and only one doctor has to fill it. Whereas Form E, 2 practitioners have to fill it, and that is from 20 to 24 weeks. So this is the paperwork. Then what you do is you enter that paper, you fold up, you fill up all the things after you finish the MTP, and within 3 hours, you fold that paper, Form 1 and Form C, or Form E and Form C, and put it in an envelope. You seal the envelope, write on the envelope that it is a secret. On the envelope, you write MTP number so and so, and then keep it in the lock and key. This is the law which we have to follow. Previously, we were not following it, but since we know now, we have to follow, because one fine day, some government officer may come and say that you are not obeyed the rules of the law. So it is better to follow the law. Secondly, when you do this MTP, then you have Form 3, register Form 3, where you have to enter the patient's name in that register, and you have to give a particular number, MTP number 1/2025 and so on. And that number is to be written in the case paper, and nowhere else the patient's name should come. The patient's name only will come on the consent form, the opinion form, and the indoor register. And after completing this, there is something called as Form 2, which is to be given at the month end, where you fill in all the things which you have done in the month and send it to the medical officer. So this procedure you have to follow. Now, next panelist can take this. Mrs. PQR, G3P2 with previous 2 female children. Now she is 26 weeks pregnancy and diagnosed as congenital heart disease, and she desires termination. So what would be the next?
So she's beyond, yes, sir. She's beyond 24 weeks, sir. So yeah. I think she comes to the purview of the third part. That is, this case has to go to the medical board.
Medical board.
The medical board, which has a pediatrician, which has a gynecologist, which has a radiologist, and you can co-opt other specialities as well. So in this case, I would like to co-opt this one, pediatric heart surgeon. So CTVS, pediatric heart surgeon, and all together we'll sit and then we discuss and see how lethal is this congenital heart disease. And then once this lady applies to that board, within 3 days, the opinion must be formed whether this pregnancy should be terminated or not. And once, if the medical board is of the opinion that it has to be terminated, then the process of termination should occur within the next 5 days. This is as per the new amendments.
Thank you. Thank you, ma'am. You have quite elaborately told this. Few points which I would like to add. The medical board is in the either medical college or the district hospital, which comprises a lot of consultants which are there. It is the prerogative of that medical board whom they want to include or whom they don't take more opinions. I as a private practitioner cannot tell them what. What I can do is I will write a referral letter to them, to the medical termination of board of medical termination, the civil hospital or the district hospital or the medical college, sending such and such patient with such and such condition. She desires termination, sending for your opinion and further course. The medical board will form 2 things. One is whether the pregnancy termination is necessary or not, whether congenital anomaly is problematic or not. And secondly, whether that termination is safe for that mother or not. That has also to be formed by the medical board. So these 2 things, the medical board forms the opinion and gives that opinion. And as you said, quite rightly, there is a timeline within 3 days. They have to go for forming the opinion and then terminate within next 2 days. So board has to examine for the opinion, terminate within 5 days. So what is the format of medical board? As we discussed, yes, Dr. Hima told us that medical board should contain gynecologist, pediatrician, radiologist, sonologist, or other numbers as may be required. And the time frame, as we said, 3 days to they make the decision, and termination for the 5 days. Yeah, quite right. So this is the Form D, where all things have to be name of the woman, age, registration. Now this is for the medical board. This is not for the private practitioners, because whether a private practitioner can terminate beyond 24 weeks is still a matter of dispute, because in our permission, which is given by the civil surgeon or the district magistrate, there is nothing written that you are given permission only till 24 weeks. And so as per today, only the civil hospital or the medical college can terminate beyond 24 weeks. But it is a matter of dispute. In few days, the court will resolve, and the private practitioner also will be able to terminate beyond 24 weeks. Yeah. Now we have discussed few things about MTP. Now we'll shift from MTP to POXO and both together. As Dr. Kalyani Singh very rightly said, teenage pregnancy is a huge problem. And we all practitioners in periphery who are in the rural setup, the teenage pregnancy is a big headache. Because illegal teenage pregnancy is a different matter. But we have legal patients who are married. The Sasuma is taking her with, sir, मैं आपके पास आई हूँ. Even my son was born here. Now she's my daughter-in-law. She's pregnant. You have to greet her. And you cannot say, no, you are less than 86 and I will send you to the police station. That's the real difficulty which we all face. But still, we have to talk about the legal matters and we have to know what is to be done. So case scenario, any panelist can take. 17-year primary comes with her in-laws for ANC registration. She is now 8 to 10 weeks. So what is your further course? Yes, ma'am.
First step is to intimate the police, sir, because she is under 18 years old, irrespective of her marital status. And also tell them why we are as well. And also we can go ahead and treat her. As such, we cannot tell just because she is, as you tell, 17 years, we cannot deny treatment. We can go ahead and carry regular ANC, routine ANC workups.
So what is the methodology where you report to the police? What, you ring them, you give a mail, you write a letter, you get a what you do?
We will write actually MLC form we will fill, sir, and we will intimate to the local police station regarding her name and her status of pregnancy and for what she has come for to us. If it is her first visit, we should just intimate her telling that it is a routine ANC format and rest the police will take care.
Yeah, quite rightly said. One thing is that we should not decline treatment because this is a medical legal case or which is less than 18. We should continue with our routine ANC treatment, whatever it is, and we have to inform the police. Now, why we have to inform the police is because it is mandatory in POCSO under Section 19 and Section 20 that whoever has apprehension that sexual assault or the child has been abused sexually or has come to know that the child, anything less than 18, has been abused, then it is his or her duty to inform the police or the juvenile referral unit that such and such thing has happened. And if we fail to inform, then we are likely to be punished, fined, or punished with 6 months imprisonment. So it is our duty to inform the police. So we have, in amongst, we had a great brainstorming and we formed this format to be sent to the police station on the letterhead, intimating that this is to inform you that Miss or Mrs. resident of such and such place of years has come to my OPD for treatment. According to her clinical examination and document, she appears to be such and such age, and she is pregnant and has come for such and such complaints. This is information for your further perusal under Section 19 of POCSO Act 2019, and you can give it on a letter pad. Now, what happens many times, police just refuse to take the acknowledgement, give the acknowledgement, or just refuse to acknowledge that they're going to take. In such cases, what you can do is you can dial the phone number, local police station phone number, which is there. You can give intimation on the phone, or you can take the mail address of the local police station. You can mail them and keep a copy of it with you, or you can send a letter and ask them to get it inverted in their register. If the police refuses to accept or acknowledge your information, you can simply mail it to their mail ID so that you have concrete proof that you have informed the police. Now, sometimes police says that you are informed, then you will have to lodge a FIR, you have to become the party to the police and you have to become party to the case. No, nothing doing. You have to simply state that I am not doing any FIR, nothing. This is my obligation, statutory obligation to inform you. Whatever you have to do is your headache and not my headache. This is for your information. That's right. Any other thing any people are doing in their society or in their local police station? What are the procedures you are following, ma'am?
Yes, sir. Normally, as we are telling in our hospital also, that we will fill up that MLC form. And if they are not, that MLC form will be given by one hospital person to the police. He should get the signature. If they are not getting putting the signature, means as you told, we have to put in the mail and we have to proceed with the treatment.
Yeah, a few private practitioners are there. What are they doing, ma'am? Please, anyone? If a 17-year-old girl comes to you, she's pregnant, she's come with us.
I think this matter is very important. Counseling part is so much important in this case. The relatives of patients should not have misunderstanding about us that we are putting an FIR against them. Just we are informing to the police, and this is the procedure. And as you rightly displayed the format of letter, that is, I think, quite sufficient.
Yes, this letter can be taken from, then you can distribute to your societies, and you can have your local people coming in the local language also. We had in Marathi also, but you can have in local language also to inform that this is done. Now, what problem arises is that many times, since we have a huge amount of population which is underage, now it becomes very difficult to inform them everyone. Now, if you are in a big institute or a big hospital, civil hospital, no one is going to point out at you. But for for example, Dr. Madan Kamble is there, myself, we are, or Dr. Bharat Pawar is there, Dr. Sachin Pawar is there. We are at small places. Now, if we try and tell the patient that we are informing this to the police station for such and such case, then they are not ready to accept it. Now, this becomes a very difficult thing. Then we have had a liaison with our local police station, local police thana. We meet them and we have told them that we have to inform such and such case, and please do not miscommunicate with the patient. Because what happens if we send the information to the police, then the police may say to the patient, "Dekho, doctor saab ne aapko khali khali problem kar diya. He has unnecessarily dragged you into a case and something like that." So you have good liaising with the local police officers and tell that we all are doing our legal job, our duty, and nothing else we are doing. So you should have liaising with the local authorities also. Call them for your annual function or some meeting or something like that. You have good liaising. They are always helpful.
Sir, one thing I would like to add. We cannot detain the patient and relatives till the police come. We cannot detain in the hospital.
No, not necessarily.
Sometimes
Why
police,
should we detain them?
No, Madan.
sometimes police don't come or come late. Patient will not stay in the hospital, in the OPDs.
Sir, recently in the paper also I had read that one of the, I think it happened in Tamil Nadu. The doctor was, because of patient didn't agree to go to for the police complaint, and later she landed up with incomplete abortion and some problems she had. So that time the court had ruled that doctor is not responsible for ascertaining. So I just wanted the experts in this panel to just, and moderator sir and others, to just discuss about this. What is the current scenario? A couple of days ago.
The court decisions do come and go, but many times there's decisions from the smaller court. It has to be from the High Court or the Supreme Court for us to become the law. But still, as the law goes, we have to inform the police. Unfortunately, something goes wrong somewhere. For example, even if she's registered with me, I'm treating her, I have not informed the police, and at one fine day she has a clamshell, there is a maternal death, and then the inquiry starts going on. Where did she come first? Where was she registered? And why was not the teenager, the pregnancy, which is less than 18 years, was informed to the police? Yes, the court has a lenient view towards the doctor. They have said that it will not be responsible doctor, or the doctor may be exempted from this. But as for today, doctors are not exempted from informing.
Yes, even if
we have to take all the responsibilities. We are not exempted from anything.
Yes, sir. Yes, Hema, even if it is your relative's daughter, then also you have to inform. If something today sir was telling some maternity goes means, then again it will be a problem. So less than 18, inform police. It is the police duty whether to take action or not. That's all. Yes, sir. So this.
Yeah. So the next question, 17 years primary gravida. She's married, unmarried, doesn't matter. She has come with early pregnancy. Now she wants a termination for some reason. So what would you do? Will you terminate?
Yes.
So pregnancy less than 18 years and whatever gestation, would you like to terminate it in your private hospital? What would you do?
This comes under POXO and MTP, so there is some overlap of things here. So we cannot deny MTP as per the MTP Act, but as per the POXO Act, she's less than 18 years. So I think we should take a midway and inform the police, ask her guardian to come in, and then form a opinion and then terminate after taking the guardian's opinion and the police into consideration. That way, I think we will be safe.
Yeah, one thing is, you have very rightly said, consent of the guardian is to be taken. But the thing is, since it is a POXO, we have to inform the police. You have not to inform about the termination of pregnancy. but you have to inform the police that such and such patient is come and this fire comes under POXO. So we need to inform the police. And secondly, if you terminate the pregnancy, then you have to inform the police that a patient such and such age is undergoing termination at such and such time at my place. And if required, you may take the products of conception for your perusal, because this would be destruction of evidence then again. So you inform the police that termination, we are doing the termination, we have informed you, whatever case you want to do, you do, but do not refuse the treatment for the patient. So what happens practically is, it becomes very difficult to terminate such patients at your place, because you don't want the jhanjat again, because the police will come, the case will go, you have to spend time in the courts and all. So practically what happens is, whenever such patient underage comes, when we inform the police, then the police makes the case if it is a unmarried patient under POXO, and they want to do further proceedings under POXO. So generally it is taken, they file the case and the custody is taken by the police or the juvenile court. And further, these patients may undergo termination at the civil hospital or the district hospital. But it becomes very difficult to terminate them at the private hospital because of all legal formalities. Not because of medical problems, but because of legal formalities.
Sir, one thing, if this patient comes in the bleeding phase, in inevitable abortion, then we have to go for an emergency situation.
Yes. Emergency, we will always treat the patient. But when it is an elective procedure like doing MTP, then you have to inform the police. And even in emergency, she comes for bleeding, you have to inform the police if she is less than 80.
Yes.
Sir, one thing, for how many days we can keep the products of conception by law? For how many days we should keep these POCs?
No,
Is there any guidelines?
any evidence you have to keep it for forever. But what you can tell the police, when you are terminated, you can remind them once or twice, and you can tell them about the thing that these products of conception may get degraded and they will be of no use. The evidence will lose its valuability. So it is the police who has to take it. And if they don't come, then you can inform them again that since this is a biomedical waste, we cannot keep it for more than 48 hours. We are going to discard it and they will be taken away within 48 hours. So what is the law of the biomedical waste, where you are not supposed to aggregate the biomedical waste at your place for more than 48 hours. Within that 48 hours, it has to go to the facility which is going to destroy the biomedical waste. So you have to tell the police, please take it away as early as possible.
That's a very good point you have made there, sir. Yeah, that's a very good point, and it will help us also and keep us safe also. And I think those products, we have to keep it in 2 different containers, one normal saline and one for formalin.
See, many acts are there. We can put them together, because this is the Act, Biomedical Waste Act, which says that when the facility which is creating biomedical waste has only right to keep it till 48 hours, not beyond that. Within that 48 hours, the facility which is going to treat that biomedical waste, it is their responsibility to take away the waste. So you can find a way in between also.
Very valid point.
Very valid and important point.
I think we have finished our cases. Any more points, any more queries from the panelists, from the participants, so that we can answer them?
Yes, in first case, in 8 weeks of pregnancy, I think hypothyroidism these days are very common. So we must investigate hypothyroidism also. And for ultrasound, I want to rule out molar pregnancy. That is very, very important. Otherwise, we can land in trouble. So do investigations, the thyroid and ultrasound for especially moral pregnancy. At 7 weeks pregnancy, it is not possible to extrauterine. It should be always intrauterine. And for size, we can see the clinical judgment. But for molar pregnancy, sometimes it is difficult. And for teenage
very
pregnancy,
valid point. Yes, please go ahead.
For teenage pregnancy, the young teenage patients are the not blood circulation of uterus and the cervix is not proper. So they give the release to the prostaglandin more, and they turn to the preterm labor and all that. That I have heard that's why I told you. And I'm also the child of teenage pregnancy. My mother was 17 years when I was born. So we had a very good time, just like other sibling. So that is also advantage that Mrs. Kalyani Singh told. That is also an advantage. We were like friends because 17 years only, just like two siblings at that time, especially. But everything is very okay. And it is very difficult to inform the police every time. Is it possible to, whenever patient comes below 18 years, 19 years, we should inform police? I think it is not very practical.
No, madam, it is practical. If you don't inform, you will be punished. So
That
it has to be informed.
See, the practical point I would like to add, we Indians are very good at making jugaads, finding ways out. Now what people are doing here, because we informed few cases, now people take that Aadhaar card or whatever identity they have, they make a PDF. These kids are very good at it. They edit the PDF, they edit the birth date, and then bring the card to us. So they are safe, we are safe. We have all kinds of jugaads for this.
We need only evidence, no sir. If it is above 18 means we are safe. That's all. So for the want of delicate Sudesh sir, I want you to answer this question. This 17-year-old girl, now you have terminated, but she tells that I cannot live without my boyfriend. How to protect me from pregnancy? Will you prescribe OC pills?
Yes, what I can do is I can counsel her.
Long-acting contraceptive injections are better. Depo-provera.
No, madam. Nothing can be done.
No. Oral pills are better.
It is not about the method of contraception. Dr. Sampath Kumari wants to know, less than 18, are you legally allowed to counsel them for contraception?
Yes, sir. For the delegates, I'm asking. So normally you cannot prescribe for a girl under 18. So you can mention it as a heavy menstrual bleeding or PCOS like that. For want of contraception, you cannot prescribe OC pills. So that is
what
also
you can do is
punishable.
you have to do a thorough counseling.
Yes.
That less than 18, if you are going to stay with your boyfriend, you yourself and boyfriend both are going to go behind bars. It is not legally safe to have sexual intercourse less than 18 because it will be a POXO case. So you have to counsel her thoroughly. And as a knowledge, you can give her knowledge of good contraceptive methods. And if she says that she wants OC pills, then under the pretext of menstrual regulation or keeping her periods together, you may prescribe her pills, but you will not write OC pills for contraception on paper. But that is a goodwill will form. But on the safer side, you will have to do her complete counseling that you should not have intercourse till you have completed 18 years of age.
Yes, sir. Thank you. Thank you. So now our Bellard sir has joined. We will have a few words from him. Dr. Bellard.
Please.
Please, our guest of honor also. Yes, a few words. I saw him, he has mentioned. Yes, Sudesh sir, you proceed. I think he is not there again. Any doubts from the panelists and delegates?
Yeah, ma'am, I had a question. Should we mention the sex of the baby if it is in the mid-trimester abortion in view of this female feticide and things like that?
I don't think so. Sudesh sir?
Yeah, there's one thing. We had a circular from government of Maharashtra previously that whatever mid-trimester abortions are there, either spontaneous or terminations, then the government of Maharashtra had specifically given instructions that we are supposed to report them to the civil hospital or the district magistrate who are in charge, doctor, and with the sex of the baby. There is no law compelling you to do that. But if the state policy is such like that, your state has given some rules and regulations or some instructions, then you should inform that. You can write it in the thing. But what you have to do is, whenever such second trimester abortions are given to the competent authority or reporting is done, you should not mention the name of the patient. Because what we do is every monthly, we are reporting in form 2 also. But still, the local authorities have requested us to report every second trimester abortion, either spontaneous or termination. If it is a medical termination of pregnancy and not spontaneous abortion, then what we give it in a format to the medical officer concerned. This is to inform you about 12 to 20 weeks pregnancy termination. MTP number such and such number 2025 underwent termination at 16 weeks for the reason, whatever the indication. If it is anomaly, then the ultrasound report and the sex of the abortus was such and such. but you do not reveal the identity of the patient or name of the patient, so that you don't come under the revealing the privacy or disturbing the privacy of the patient. Because previously, if you unfortunately reveal the name of the patient, the fine was only 1,000 rupees. But now there is a heavy fine and the punishment also for that. So you have to keep the name of the patient secret if you're doing termination of the pregnancy. The name of the patient should not come anywhere in the OT or your other admission registers or your indoor papers. It should not come anywhere. There, the patient should be Christianized as MTP number 2/2025, and that should be the name of the patient, and the indoor paper should come on that thing.
Actually, yes, sir.
There is a question in the question box.
Yeah.
There's a question in the
Confidentiality.
question box.
Yes.
Question box.
Yes.
Ruptured ectopic in shock, 17-year girls has come. How to proceed? Well, the same thing will apply. You proceed with your routine treatment, that you will manage her shock, go for blood, manage OT, everything will done. But at the same time, you have to inform the police that this patient has undergone sexual intercourse. And so you have to inform the police about the pregnancy. You have to inform it. Yes, Dr. Hema, you wanted to say something? You are muted. Unmute yourself.
In an institute, sir, maintaining confidentiality is it's a tough job, sir. And actually, for our college, I'm the MTP in charge. It's very, very difficult to maintain, sir. Because admission is done centralized admission, and we have so many departments. So do you have any ideas to how to do it, sir?
Yes. One thing what we can do is, when the patient comes in the OPD, she's Mrs. A, B, C, X, Y, Z, whatever it is. Now, when you want to admit that patient for MTP now, what you do is you make a case paper of OPD with the name MTP number 01/2025. So that would be the name of the patient.
Okay.
Your system will accept that. Agreed. And in place of whatever it is, the system sometimes requires the identity of the patient, as the address of the patient, the telephone number of the patient, whatever it is. Everywhere you can put the same thing, MTP number 01/2025. So that will come as the identity of the patient in the further papers as IPD paper. If it is a centralized computerized thing, it will come like that. So that will come. My place is a small place, but I have been using this method for almost since 2013. I re-christened the name and named the patient as MTP number 1/2025.
Yes,
but there are few systems which do not take numbers in the name sector. Few computers have that problem. Then you have to talk to their technician there and make the provisions that in the place of the name, not only alphabets but also numbers can be added, because that is a problem in some places.
Yes,
That
sir. Yes,
becomes
sir.
easier.
Yes, sir. We'll try that. Yes, sir. Thank you, sir. Thank you. Thank you, sir.
Thank you, Dr. Sudesh. Fantastic panel and very good panelist. If you have any doubts, you can clarify, I think.
Yeah. One more thing which I would like to emphasize a little, not for MTP or POXO, but I have been a part of National Inspection and Monitoring Committee, which is a committee at the central level. The government of India has few delegates, then the local government has, and our FOX is fortunate enough to have one of the representatives in the National Inspection Monitoring Committee. Now, this national level team goes to many places to monitor the ultrasound process which is being done. We check the F forms, check whether there is sex determination done or something like that. And unfortunately, I have found that in South, specifically Tamil Nadu and Kerala, few places people are not very well aware of the PCPNDT Act. They are not filling the forms. And unfortunately, if you don't fill the forms, then the law says that you are a person to be punished. So we need more number of few more webinars or few programs for education of our gynecologists so that they don't fall into this trap. We Maharashtra have learned it a very hard way, because we were the first who were targeted. Few of our colleagues had to go behind bars for not filling the form. But filling the form F is mandatory and you cannot excuse it. Because I tell a personal incident. 5 years ago, I was in Tamil Nadu district place, and where I went to radiologist to check just sir kya hai kya nahi in the NMC, and he argued with me, sir, this is only 8 weeks pregnancy. How can you detect sex at 8 weeks? So why should I fill their form? Now such arguments don't work. In front of the law, you have to fill the form. You have to fill their form. So I don't want to blame anything. People from South are very brilliant, very academic, but this is what I found there. Maybe radiologists and gynecologists, they need to be told that this is a thing which has to be done. At Foxy platform, we are doing it everywhere, but we need to reinforce them some more in the South.
Yes, sir. We'll do it.
And I would be happy to part of it. If anyone wants ask me to give a lecture on Zoom, I will give it definitely sure.
I will catch you, sir, hereafter.
Yeah. Thank you.
Very nice discussion, nice cases. If no more questions, I think we are on time. Question answer, you have answered ectopic. Other than that, we don't have any questions. Okay, sir. Now we'll come in that. Madhumita, are you there?
Yes, ma'am.
Yes.
Yes.
With all the supports, you can proceed with the vote of thanks. We had the wonderful panel and panelist and speaker. Yes,
Yes.
Madhumita.
So coming to the end of this wonderful session, at the outset, I would like to thank Sampath Kumari ma'am for bringing us this wonderful webinar series, which unites all the corners of the country. And I would like to thank our Hapur Society President and Secretary, Dr. Uma Sharma and Namita ma'am, and Purnia Obstetric and Gynecological Society President, Dr. Bibaja, and Secretary, Dr. Anuradha Sinha, Sastra Society, Dr. Kalyani Singh and Dr. Sangeeta Thakur, Pandharpur Society, Dr. Sudesh Joshi and Dr. Sachin Pawar, Aklut Society, Dr. Bharat Pawar and Dr. Manisha, and Belgaum Society, Dr. Sumana and Shweta Patel. I would like to thank our chief guest, Dr. Rajana Khanna ma'am, for accepting immediately and gracing the occasion. I would like to thank our guest of honors, Mrityunjaya Bellad sir, Dr. Sumaya Firdaus ma'am, and Dr. Bharat Pawar sir.
Madhumita, 1 minute. Bellad sir came. He didn't. If he is there, he can tell 2 words. Bellad
Yes,
sir, are you there? No. Yes, you proceed.
Yes, ma'am. And I would like to thank our first speaker, Dr. Kalyani Singh, and chairperson, Dr. Sachin Pawar, and our esteemed moderator, Dr. Sudesh Joshi, our expert, Dr. Uma Sharma, and our dear panelists, Dr. Sangeeta Thakur, Dr. Madan Kamble, Dr. Biba Singh, and Dr. Anuradha Sinha, Dr. Hema Patil, and Dr. Swati for making this panel very interactive and elaborate. So, and I would also like to thank our dear delegates who have joined, who are with us today. And I would like to thank Sarthi and Shield for the technical support throughout. Thank you very much.
I thank Dr. Madhumita for the coordination. Thank you, all of you. Thank you.
Sampath
Good
ma'am,
night.
thank you.
Thank you,
Thank you,
Dr.
ma'am.
Madan. Have a good time. Dr. Sudesh sir, Sachin sir.
Thank you.
Bharat.
Thank you, ma'am.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Kalyani ma'am.
Opportunity.